The Speaker of the House of Representatives, Femi Gbajabiamila, says a bill for an act to establish federal universities of medicine and health services bid in Niger State for the purpose of providing qualitative education in medicine and health sciences and for related matters seek to alter the architecture of the nation's public health services in ways that will hopefully improve the lives of the people. This was made known at a one-day public hearing organized by the House Committee on Health Services. The Speaker, who was represented by Honorable Nkiruka Onyechocha, says either through increasing options available for medical training or providing access to medical facilities in places where there is an evident need, the bill will give Nigerian talented individuals an edge in delivering their services to humanity.
Each of these bills seek to alter the architecture of our nation's public health services in ways that would hopefully improve the lives of our people, either through increasing options available for medical training or providing access to medical facilities in places where there are an evident need. The purpose of this public hearing today is to harvest the views and opinions of stakeholders so that through the aggregation of those contributions, the House can act to improve each of these bills in line with the best expectations of the citizens whose mandate we serve.
The sponsor of the bill, Musa Abdullahi, former governor of Niger State, Babangida Aliyu, former Health Minister Jerry Gana, and Minister of Health Osagio Ehanire all threw their weights in support of the passing of the bill, saying it will be an added advantage to the Nigerian health system, not just Niger State.
Actually informed the proposal is the dearth of manpower that we saw in the healthcare sector, and realizing that we have children with capacity and the willingness to take on courses in medical sciences, but unfortunately we've not created enough opportunities for those students. Realizing those things, we decided to come about this proposal.
It's not only Niger State, it's Nigeria. Okay. If you noticed, every university in the country admits people virtually from all the states, even though there are some universities that are made as catchment areas of particular states. But any university established is allowed to admit, so it's for Nigeria. If you look at the statistics as it is, 1 doctor to 4,000 people, and for WHO is probably 1 doctor to 1,000, or 600, for the WHO is 600. But in most countries it's 1,000 people to 1 doctor. But in Nigeria, even if we say 4,000, there are many villages and many areas that have never seen a medical doctor.
50 to 60% of healthcare is delivered at primary healthcare level, and then about 30% at secondary, and 10 to 20% at tertiary. So we need to think of developing the entire value chain. And while we very much welcome development of more human resources, schools of medicine, we must not forget that it has a foundation, and that foundation must be strong, and we must also be ready to give the same attention to it that we are giving to training higher levels of personnel.
I'm delighted that from what you've heard so far, this bill by Honorable Seydou Musa and other colleagues for the establishment of a University of Medicine and Health Sciences in Niger State, located at Bida, is very highly supported, is very acceptable, is fully endorsed. We like it, we admire it, we want it to be passed in law in no time at all.
The Chairman House Committee on Health Services, Honorable Chike Okafor, says in line with the 9th National Assembly agenda, they are looking into the performance of health to Nigerians, especially with the COVID-19 pandemic, to ensure Nigerians get the best in medicine. Annie T. Patrick, Core TV News, Abuja.